الرحمن الرحيم. أسعد الله أوقاتكم بكل خير وتقبل الله منا ومنكم صالح الأعمال. للاقتصاد الدوائي دور أساسي مهم في اتخاذ القرارات، ليس بالرعاية الصحية فحسب، بل بالاقتصاد الوطني لأي دولة، لأنه يساعدنا على اتخاذ القرار المناسب في استخدام أي دواء. يسرنا إسبر الفرع الطلابي بجامعة الأمير سلطان تقديم محاضرة بعنوان Jobs in Pharmacoeconomics and Outcome Research لتتعرفوا معنا أكثر على الوظائف المختلفة في مجال اقتصاديات الدواء. سيقدمها لكم الدكتور سليمان الغنام، رئيس قسم الصحة السكانية بمركز الملك عبدالله العالمي للأبحاث الطبية ورئيس إسبر السعودية، حاصل على دكتوراه في علوم الصحة السكانية وماجستير في الإدارة الصحية في الولايات المتحدة وبكالوريوس في إعادة التأهيل والعلاج من جامعة الملك سعود. أهلا بك دكتور سليمان، سعيدين جدا بتواجدك معنا اليوم.
الشرف لي ويعطيكم الف عافيه. صراحه سعيد جدا بالاستضافه واشكر يعني وقتكم. عارف انه وقت بعد فطور والكثير يعني يمكن يكون عنده التزامات، فاستقطاعكم الوقت هذا للجلسه هذه أنا متاكد ان شاء الله راح يكون دافع لعمل المزيد مني ولا من الزملاء اللي ممكن لهم خبرة بسيطة في هذا المجال لدعم مستقبل طلابنا وطالباتنا. أنا عندي شرايح، بطفي الكاميرا بس حبيت أمسي عليكم جميعا، أمسي على الدكتور، وبعدين بحط عندي شوية سلايدات يعني it's not going to be a lot. Maybe to set the stage. Then we can kind of have a discussion about it. Okay, this will stop. Give me 1 second. I think I got the slide. Can you see my slides?
أيوة دكتور، واضحة.
Okay, so بسم الله الرحمن الرحيم. السلام عليكم جميعا. Again, thank you for this opportunity. طبعا in the next few minutes I'm going to be covering primarily three main outline, if you say so, to set the stage about talking about careers in healthcare in Saudi Arabia and in pharmacoeconomic and outcome research. I think it's important to set the stage by highlighting why this is a different time than 10 years ago, 20 years ago. And this is something that's relevant to what I'm going to be talking about next, which is the role of health economics, macroeconomics, and outcome research in the current climate. If you ask me 20 years ago, it's definitely may have not been as it is today. So for the reason that inshallah we're going to highlight. So this is the second maybe outline, and then we'll conclude about some of the future opportunities that we see as individuals in the field for now. We might not be the best expert in the world, لكن we in the past 2 years we've been engaging either professionally or via Saudi ISPR in many initiatives that we've seen some opportunities coming over and over. And I always think putting our students in this path will help them better be prepared for once these opportunities arise, and definitely highlight some of the needed skill sets. So, as you all know, we are in an exciting time where the Saudi Vision 2030 is undergoing. I was fortunate enough to be here when the first vision was announced. I came back to the kingdom in 2016, right when the Saudi Vision was launched. It's very important for you as a Saudi citizen to be familiar with the Saudi vision, not only for professionals, but you really need to understand it, because this vision is not the job of the government. This is the vision, is the job of every single person in the country. There's three main pillars, if you say. So ambitious nation, thriving economy, and vibrant society. So these strategic objectives is what drive this vision. And as you can see in the second one, so thriving economy kind of contain everything when it comes to the economy. We really need to, as a country, shift from an oil-based country into more of a producing country in all aspects, and that definitely includes healthcare. As you can see, several programs at the bottom, I'm sure you're familiar, you've seen many of them. The changes that we see nowadays are actually a result of that. Zooming in, as you can see here, there's a health sector transformation program. And as I highlighted, this is definitely part of all the three strategic objectives. So thriving economy is something that is taken into account when we talk about the healthcare transformation. So why do we have a vision? Somebody may ask. I outlined that we do have a vision because we need to shift away from oil-based economy. But specifically for the healthcare sector, why do we have a vision? We have money. Why can't we just continue as usual, business as usual, have more hospitals, more clinics, and graduate more professionals in the field? And the answer is we must change, because in order for us to keep up with the change in the health status of the country, we really need to think about innovative ways to cope up with that. So unfortunately, we have an unsustainable burden when it comes to disease burden. So there's unhealthy lifestyle that's prevalent. So obesity is in the ranges of 40 to 45%. Which is definitely high. It's going to play an impact on healthcare resources. Chronic conditions are prevalent. So currently about 8 million individuals in the kingdom have a chronic condition. This number is expected to increase to about 10 if we don't do anything in the year 2030. That is extremely important for many reasons, some of which is that these increase in health burden, it has an impact on health costs. Estimated that health costs increase in about 4% every year. That will definitely be exacerbated if we do not do anything, or we do not do the transformation in the kingdom. Aside from health cost and disease prevalence, it is unfortunate that disease burden is affecting premature death. Saudi Arabia is a G20 country. So it's one of the great 20 countries in the world. So really need to have the characteristic of a G20 country. We are not a developing country anymore. Therefore, it's not acceptable that premature mortality in the kingdom is really high. And it is similar to developing countries. It's estimated it's about 46% of death that occur way before they should do. So luckily, the health transformation program is a really massive and comprehensive program. It focuses on a lot of aspects, really emphasize in improving healthcare services, improving access to individual services, improving access to preventative services. And more importantly, we're really happy to see that as part of the Saudi vision, there's really a revolution when it comes to digital health. And that plays a lot of roles in advancing our effort for efficiency, and more importantly for us, more opportunities for careers related to pharmacoeconomics, outcome research, because of the availability of these data hubs. So, zooming more on the drivers for change in the health transformation program. So as I highlighted, we have a significant burden of disease. And it's not feasible and it's not efficient to continue to treat, to act like a car repair shop. People get sick and we treat them. I remember back in the days, so I started, as Amira highlighted, so I started my career as a physical therapist. And I remember in my early days, I expected to treat a lot of old people in the hospital because I was situated in a neurology department. And to my surprise, most of the patients that I used to see were actually young. Teenagers and people in their 20s. Why? Because many of them were victims of traumatic injuries, either road injuries or falls, and developed disability, and that resulted in permanent disabilities. And that, as you may can imagine, it's a significant burden to population health. So I started asking the question, why can't we prevent all of those conditions from happening? And this is what got me into the area of public health. So luckily, we in the kingdom now are recognizing that in the sense that we're saying we no longer need to be a hospital delivery system focusing only in treating patients. We really want to keep healthy people healthy so they don't show up in our hospital. And this is really one of the drivers and many opportunities that relevant to that will be available for you in case you want to work in outcome research in the future. The second driver is access, and certainly the COVID-19 pandemic have taught us a big lesson in capitalizing in the availability of technology to facilitate booking appointment, telehealth, vaccines, and so on. So we're really making a good progress and that will hopefully develop and increase in the future, creating more opportunities. And last, more importantly, that one of the things that you're going to be hearing about a lot in the kingdom in the next 5 years is value for care. What do we mean by value for care? As I mentioned, we really don't want to be a car repair shop. You get sick, you come, you get treated. That's no longer the aim. We really want to provide what we call value-based healthcare. And in value-based healthcare, what do we mean by value-based healthcare? Basically, quality over cost. What do we mean by quality? Basically, patient outcome, hence pharmacoeconomic and outcome research, patient experience, and cost, whether it's direct cost, whether indirect cost. The good news is there's a lot of shortage in experts when it comes to value-based healthcare in the kingdom. And literally, as early as last month, I was in a meeting and one of the high ranked leaders was asking, we really need a health economist in our team. So unfortunately, we don't have a lot of expertise in the kingdom, and thus those who invest in this area will have an edge. So outcome divided by cost, and this is part of the payment scheme, or the way we're going to fund healthcare in the next decade or so. Luckily, we're all part of ESPOR, whether it's the Saudi ESPOR or the student chapter in Prince Sattam University, and we follow the hot trend in the international ESPOR. Every year or so, they publish the hot trend in health economics and outcome research. And as you can see, those are the hot topic. And believe it or not, they're the same in Saudi Arabia, luckily to many efforts by professionals like Dr. Mary, Dr. Befi, and others in the kingdom. So real-world data, health equity, healthcare financing, drug and healthcare pricing, public health, health technology assessment is on the rise in the kingdom, and more on the health data aspect and artificial intelligence. So moving on to what are some of the existing opportunities that I personally have seen in the past 2 years or so. I put here a disclaimer, this is not an exhaustive list, but we're just really shedding some light into some of the available opportunities based on our experience, whether it's in the professional work environment, my work in the National Guard, or as part of ESPOR in many of the events that we either organized or attended in the kingdom or in the GCC countries. So my opinion, I would classify career opportunities in pharmacoeconomics into two main branches, what I call private path and a government path. Private path include pharma industry and consulting industry. So if you asked me 10 years ago whether consulting is an option, definitely not an option that's prevalent 10 years ago. But now it's really a big player in the scene in the Kingdom of Saudi Arabia. The second the second, I would say, path is what I call government path. And government path is really a huge field. It could be the regulator, the provider, or like myself in academia or in research. So we'll dive for a few minutes in each one of those, and hopefully this will highlight some of the opportunities. So in the pharmaceutical industry, there's a lot of opportunities. In pharmacoeconomics specifically, outcome research, the work in disease registries and real-world data, all of that we've seen in many of the companies. This is not an exhaustive list, but companies like Johnson & Johnson, Pfizer, Amgen, Roche, Sanofi, really seeing some initiatives, some events that really emphasize the role of pharmacoeconomics, which highlight their interest in recruiting and attracting the next generations of experts. Obviously, these employers look for a lot of things. They look for knowledge, quality, related to personality, but some of the emerging or new hot topic that I've seen personally, and I'm sure many colleagues seen that as well, is expertise in real-world data. So real-world data is data that are not necessarily generated by randomized controlled trials, data that are beyond controlled environments. So these could be based on electronic medical records, could be based on other sources like billing information. Anything that can tell us what would happen in the real world is fair game. Example of the needed skill: individuals with ability to navigate through big data platform. So if you have any opportunity to explore either training or collaborations with experts in this area, this is really important. One of the areas also translating health data or large health data into big research initiatives highlighting health economics and outcome research. So one of the areas that I'm working in with colleagues who are experts in pharmacoeconomics is how can we translate clinical notes into structured data that allow analytic and guide decision makers. So basically, physicians write their notes in the chart, in the electronic medical record notes. How can we transfer this notes into structured data that can guide health economics and outcome research? So this is really cutting edge when it comes to the kingdom research, and not a lot of people have the ability to do so. The other branch of private industry is what I call consulting companies. So as I mentioned, many of the programs within the Saudi Vision 2030 are supported by high profile consulting company. And many of these companies are now exploring significant major projects in the kingdom. I don't know if you heard this decision. The kingdom did an amazing decision where they mandated big companies to have a headquarters in Saudi Arabia by the year 2025, which would be great because it would mean creating more job opportunity for potential applicants. So some of the companies that are now working in the kingdom in many projects related to pharmacoeconomics are PwC, McKinsey & Company, Acquivia is a big one, and Ernst & Young. Again, this is not an exhaustive list, but in my experience in the past 2 years, those are some of the big players when it comes to project related to pharmacoeconomics. So being part of a consulting company is different than other industries. So obviously you all anticipate that in a private sector, you probably put in more work. Work is intense compared to governmental agency. Working hours might be longer. In my opinion, consulting is definitely more intense than the pharma industry. However, it might be more rewarding when it comes to job growth or financial consultation. Having said that, being part of consulting is not something easily you can get into. They're really requiring high qualifications, some of which include knowledge of the governmental sector. So I've seen colleagues, for example, start their careers after graduating from the university in the government, either a hospital or FDA, Ministry of Health, you name it, and then move into consulting company after they develop some understanding of the government sector. Why this is important? It's important because most of the time, the government sector are your client, and you really need to understand the lay of the land. The second, I would say, basic requirement for career consulting is really strong analytic skills, being able to retrieve data from multiple sources, synthesize this data in a way to be presented clearly and efficiently to your client. And lastly, effective communication with provider. So we were saying effective communication with provider, really emphasizing clarity in communication. So being able to summarize big report in nice PowerPoint presentation, it's a skill that it's basic. You can't not have going into consulting. And on the contrary, you have to have an advanced skills. You could be an expert in PowerPoint, Prezi, Photoshop. Those could be some of the skills that set you apart from somebody who just has basic knowledge of PowerPoint. Why? Because this is important to, again, engage with your client, which most of the cases, government agencies. So moving on from the private sector into government entities, and that could be legal entities. The Saudi FDA is a big one. All of you know some of the opportunities are available there. But now one of the new players is NIPCO. NIPCO is emphasizing the need for pharmacoeconomics. We had many events where we had individuals from or colleagues from NIPCO highlighting the role they play, and certainly pharmacoeconomics is something that will support them. Another big potential recruiter is the government provider or payers. This includes the Ministry of Health, King Faisal, National Guard, military hospital in the kingdom, to name a few. Obviously, the Ministry of Health is a big one. As part of the Ministry of Health, there's a programs called FAB, or I can't remember what the acronym stands for, but FAB is really taking the role of financing healthcare of the kingdom in the transformation program. So pharmacoeconomics, outcome research are key for FAB. Also, we definitely anticipate in the kingdom that we will witness the establishment of an HTA body, Health Technology Assessment Agency, similar to NICE in the United Kingdom and other entities. So this definitely going to be a potential place for recruitment in the upcoming years. Lastly, academia and research center. Now, as I mentioned, there's an emphasis on efficiency in healthcare. There's emphasis in reducing waste. There's emphasis in value-based healthcare and preventative services. All of those would require analysis related to pharmacoeconomics and outcome research, cost-effective analysis of various medications, various interventions. Those are all fair game. We in KMARC are one of the potential recruiters. We're looking for people with expertise in health economics and health outcome. Princess Noura University also have a research center. And luckily, one of the newly established entities in the kingdom is the Saudi NIH. For those of you who are not familiar with the Saudi NIH, so it's short for the Saudi National Institute of Health. In developed countries like the United States, the NIH is a funding body, basically a funding body to give money to researchers. And in order for them to understand the value for funded research, they really need to do research in outcome and health economics. Therefore, investing in skill sets related to health outcome and health economics is a key. I was fortunate enough to be part of many workshops in the establishment of the NIH. And I can tell you, in every workshop of national, and I'm talking about national workshops about disease burden, one of the things that experts talk about is we don't have an idea what is the economic burden of diabetes, what is the economic burden of stroke, and so on, you name it. So this is something that's needed for policymakers to prioritize between intervention and to plan future healthcare resources. So the Saudi NIH luckily is going to be investing in this area in the future, hence more job opportunities. So now that I laid out some of the available and hopefully potential future opportunities for you in the future, let's spend a few minutes talking about what could you do, in addition to the amazing effort you're doing in the student chapter, to cultivate your skills to become really attractive for potential recruiter. The first thing is learning the skills, basic pharmacoeconomic, pharmacoepidemiology, research methods, being able for data to do data analysis, becoming very comfortable in searching and synthesizing the literature, and really publishing in peer-reviewed journals or white papers, or even report. So the thing is, for potential employer, now the competition is high. So it's no longer the case that, you know, they get CVs of fresh graduate students and they say, okay, they graduated Prince Sultan or King Saud, they're great. No, it is expected now that a student graduated from the university in a healthcare field, that they have a peer-reviewed publication. And potential employer will look, what type of publication did Amira do? Did she do anything related to health economics or no? Because you could claim that you're doing health economics, but if you are interviewed and you're asked and you don't have any effort to show for that, your chances are low. But if you have publications and you know what was the publication is about, this will get you into the door. The other thing that I highly recommend is really engaging in the field beyond the skills that you learned in the university. Dr. Al-Pipi highlighted that you did an amazing job learning about pharmacoeconomics without having a formal training in pharmacoeconomics. This is great, but it's not enough. You really need to get out there, attend event, network in any field, understand who are the big experts in the field and attend their talk, ask them questions in these talks and conferences. I have to admit it, we in the field sometimes are disappointed with the poor attendance in conferences by students. Keep in mind that all of these conferences are free for students. This is a luxury. You will not have this opportunity in other countries. When I was a graduate student in the US, and I'm sure Dr. can relate to that, I would say 99% of the conferences we had to pay out of our own pocket to attend. Yes, they are in developed countries, in countries like the United States, but nowadays we have many of these experts in the kingdom. So it's really disappointing to see poor attendance in conferences, despite the fact that it is free most of the time. And the last thing is basically volunteer. You have to show that you are taking the initiative. This will definitely help your CV in establishing some of the skills. And you never know. Believe me, I've been part of many groups where somebody who was initially a volunteer became an employee of an organization, because everybody in the group knew who he was, and then developed a good relationship with everybody and proved that he had the skill set that it needed to get the job done. I really love a quote by Denzel Washington. Some of you might have seen the video of him on YouTube, and Denzel Washington says, if you hang out long enough in the barbershop, I can't remember the exact quote, but the idea is, if you hang out in the barbershop, if you hang out a lot, if you hang out long enough in the barbershop, eventually you'll get a haircut. And the idea is, if you really show your enthusiasm and initiative, whether in volunteering or being part of a research project, people will recognize you, and then they will offer you opportunities. And so, as I mentioned, national conferences, you get a certificate and recognition if you do volunteer, and if you get the chance, attend the international ESPO. I'm almost done. I want to conclude with key reminders. The first is, be responsible for the accuracy of your CV. And believe me, the biggest turnout to me to hire someone, even if they're good, is when I discovered that they lied in their CV. So if you say something about pharmacoeconomics in your CV, you better be ready for a question in the interview to test your ability to use those skills. And lastly, you have to maintain a professional online image. You have to have a LinkedIn account with your credential. If you have a Twitter account, keep in mind that people will look at it. Potential recruiter may look at it and see if there's something inappropriate in it. That may reflect in your chances. This is a reality. Yesterday, I was doing a talk with somebody about a potential TV interview that they are planning, and he mentioned to me that he scrolled down into my social media account to see what are some of the things that I posted about. So social media account is something that people check. So you have to be responsible in maintaining a professional image. Some of the future opportunities that I didn't see in the past 2 years, keep in mind everything that I highlighted in the past half an hour or so was about the past 2 years climate. What I see in the future is more opportunities in healthcare health system financing, innovation in health economics and outcome research. Definitely trying to come up with ways to reduce waste, to become more efficient. This will result in more job opportunities. And strong analytic skills, machine learning, artificial intelligence, are hot topics areas, or not areas, entities like Sadaya might be interested in hiring somebody with strong analytic skills and ability to analyze big data and come up with strong evidence about a topic related to health economics and outcome research. And lastly, reducing waste and efficiency in healthcare. As I mentioned, we spend billions of reals every year on healthcare. The government wants to reduce spending in the most efficient way that will not affect healthcare quality and healthcare outcomes. So thinking about this, how can you invest in that is a key, and definitely will translate in more jobs in the future. Take home message to you. First, find a job related to something that you like. Don't care about money, at least at first. So if you're passionate about pharmacoeconomics, outcome research, find a job and learn. Be like a sponge, learning everything around you. Don't care about the money at first. If you develop career, I would say after 5 years, start developing the sense that, well, whoever value my skills, I would go to. But first 5 years, focus on learning the skill, focus on how can you stand out compared to others. The other thing is, I see a lot of CVs of new graduates, and believe me, in a lot of time I see a lot of skills. They say, well, I'm good in scientific writing, PowerPoint presentations, data analysis. They put a lot of things. But in reality, they are not great in those things. They know them, but they're not great at it. But if you're great at, for example, scientific writing, English is superb. This is something that you should highlight in your CV. But be prepared to be tested for it. So if you say, I'm great at data analysis, be prepared to be asked, okay, what kind of analysis you can do. I remember one of the best students I've ever seen was, now he's, mashallah, resident in ophthalmology. He reached out to me and he saw me in a conference and he said, Doctor, I really want to work with you. I like data analysis and I work with statistical software. And it happened that I was using the same statistical software. So I was like, okay, so how do you do regression in this? And he answered, and he, at that moment, sold me. And I was like, okay, I want to work with the student. And we ended up publishing a paper together. So I asked, he emphasized the skill that he's doing. I asked him a quick questions and he answered it. And I knew it's going to turn out great. So be great at one thing rather than okay and many. And lastly, and I know might not be available for all of you. Now we know scholarships are not like they used to be. But if you get the chance to do a master's degree in pharmacoeconomics and outcome research, I would say go for it. If you have the ability to do a degree in public health, epidemiology, biostatistics, all of that is fair game, and it will help your career in the field. That's all I have. I think we have 10 minutes for question. I apologize for taking the time. And again, I really thank you for this opportunity. This is my email and my Twitter account. I'll be more than happy to answer any question either now or via email later.
شكرا جزيلا يا دكتور، بيض الله وجهك وجزاك الله الخير. وإذا يسمحوا لي الطلاب والطالبات ببدأ بالسؤال. أنا أولاً أحب أشكرك على الانفورماتيف برزنتيشن. صراحة أنا عندي وظيفة، I have a job and it was very informative for me صراحة. الله يعطيك العافية يا دكتور، ما قصرت. بدي بس نأكد على نقطتين للطلاب. لو لاحظتوا الدكتور سليمان الله يعطيه العافية use his own experience in his first job. وصراحة ما كنت أعرف المعلومة هذه يا دكتور. أنك توظفت و you saw the majority of your patients were young. This was your motivation to continue your PhD. And I remember I met you in the US in ESPR. When you talk about the subject were car accident using maps. So that's fascinating. So this is a message for students. الأشياء اللي تجذبك. حتى أنا ترى رسالة الدكتوراه حقتي كانت في الديابيتس، وكان أنا interested in because a lot of people I know close to me were affected by diabetes. So my motivation or my interest was diabetes. فهذه أول رسالة يعني دكتور الله يعطيك العافية أرسلتها للطلاب، وإن شاء الله إنهم سمعوها زين. انطلقت من عندها انطلاقة عظيمة، والآن ما شاء الله عليك يعني من أفضل الدكاترة في المملكة العربية السعودية إن لم يكن في العالم كله في الببليك هيلث regarding car accidents والانجريز اللي تحدث أثناء الكار اكسيدنت. سو لازم نركز على أن يكون عندنا موتيفيشن، عشان ترى في النهاية أثناء الدراسة ما هي سنة أو سنتين أو 3 سنوات، الجوب مو هو 4 أو 5 أو 20 سنة، يعني طول حياتك. وما كان عندك الموتيفيشن انك تحب الشيء هذا وتكمل فيه، حتى لو طفشت، حتى لو جاتك ظروف عائليه، تكمل في هذا الموتيفيشن لانك انت تحبه وتسعى له. فشكرا يا دكتور to bring this up. صراحه اشوفها رساله مهمه طرحتها اليوم، الله يعطيك العافيه. شيء ثاني في شيء السكولرشيب. نعم السكولرشيب قلت عمان، لكن ما زال الان الجامعات تفتح برامج ماجستير، وبرامج ماجستير فخمه بكل ما تحمل الكلمه من معنى، يعني اكريديت من NCAA، يعني ما هي اي برامج. جامعه الامير سلطان عبد العزيز ان شاء الله السنه القادمه او اللي بعدها بالكثير بنفتح برنامج ماستر ان هيلث ايكونومكس، اسمه كذا هيلث ايكونومكس. فلا في برامج متخصصه. وعلى كلام الدكتور اللي يتكلم عنه شركات الادويه، انا ما كنت عارف الماده يا دكتور انها جايه السعوديه الان في elaborate more، يعني جت شركات السعوديه من برا السعوديه الى السعوديه. هذه مرة معلومة مهمة ماني عارفها يا دكتور، ممكن توضحها زيادة كيف بتجي شركات أدوية من خارج السعودية؟
هو قرار أتوقع صدر قبل سنة أو سنتين، إنه by the year 2025 لازم الشركات الكبيرة يكون عندها headquarter في المملكة. فهذه يعني راح يكون أي من الشركات اللي لها تعامل مع جهات حكومية راح يكون لها headquarter في المملكة. فهذه راح تلعب دور كبير في خلق وظائف لخريجين وخريجات في المستقبل إن شاء الله.
الله يعطيهم العافية ووفقهم إن شاء الله الطلاب. أنا خليت وقتكم بس 7 دقائق تسألون الأسئلة اللي تبغونها، تفضل.
شكرا دكتور سليمان، دكتور عبد الله. فعلا كنا نحتاج يعني أشخاص من هالمجال ومثل خبراتكم إنهم يعرفونا كيف ممكن نطور أنفسنا، ويعني الفرص المتوفرة لنا كطلاب أو من يرغب بأنه يبرز نفسه في هذا المجال. الآن نستقبل أسئلتكم. اللي عنده سؤال يتفضل سواء في الشات أو بالمايك.
أشوف السؤال من أحمد الهلابي عن المسمى الوظيفي المتخصص في اقتصاديات الدواء في المستشفيات. للأمانة ما يحضرني، لكن I'll get back to you بالإجابة. لو ترسل لي بسم الله يا أحمد رسالة على إيميلي تذكيرا، بإذن الله أستفسر عنها إن شاء الله غدا في الحرس عندنا I'll get back to you. لكن keep in mind المسمى قد يختلف من جهة إلى جهة أخرى. المسمى قد يختلف من جهة إلى جهة أخرى. لا يهمك المسمى كثر ما يهمك الجوب ديسكريبشن. مهم إنك قبل ما توقع أي عقد أو تقدم على أي وظيفة تعرف وش الجوب ديسكريبشن. غالباً الوظيفة التخصص في اقتصاديات الدواء تكون لها ديسكريبشن واضح يحفظ لك يعني الاكسبكتيشن اللي you're looking for. فأنت هذا أهم شيء أنت يعني، لأنك even بالسي في في المستقبل خلينا نقول توظفت مثلاً فارماكويكونومست في مستشفى إكس، in your CV في المستقبل تحط التايتل، حتى لو التايتل حقك فارماسيست 1 مثلا، تحط what are the job responsibilities حقتك، تكون 4 أو 3 إلى 4 bullet واضحة describing the role that you play when it comes to pharmacoeconomics. لأنه مهم للبوتنشال ريكروتر يقرأ الأشياء هذه يعرف what are you doing. لما معليش أنا قاعد go ahead فيصل.
يعطيك العافية. أول شيء دكتور سليمان، أنا أمانة عندي سؤالين إن شاء الله يعني ما تكون إجابتها طويلة يعني ما أطول عليك. السؤال الأول دكتور سليمان هو بخصوص ال HTA أنت تكلمت عنها. أنا أبغى أعرف يعني إحنا وين واصلين في موضوع ال HTA. إحنا سمعنا عنها كثير الفترة يعني السنتين الماضية وبعدها توقف الحديث عنها وكأنها هي ما أعرف إيش حصل معها. هذا سؤالي الأول. سؤالي الثاني كوني أنا الآن أعمل في أحد شركات الأدوية وأنا طالب ماجستير في تخصص الأبلايد فارماكويكونومكس. أنا عندي الرغبة أمانة إني أنا أكمل في هذا المجال في شركات الأدوية. فأنت شايف دكتور سليمان إيش الرول of الهيلث ايكونومست في شركات الأدوية؟ يعني أنت تكلمت على موضوع الريل وورلد ايفيدنس، ولكن إيش ممكن يعني هل هذا هو الرول الوحيد له، أو هل هو راح يكون conducting يعني economic evaluation؟ كنا نسمع إنه لا الشركات ما راح تسوي economic evaluation كونه موضوع ممكن يكون شوية biased، فالموضوع راح يكون في يد consulting companies. فهذه يعني هذه gray area إلى الآن إحنا ما إحنا عارفين إيش ممكن يكون الرول حق الهيلث economist في شركات.
Thank you فيصل. excellent question صراحة. يعطيك العافية. بالنسبة to your first question, طبعا HTA حتى لو توقت الكلام عنه it will happen in the kingdom for sure إن شاء الله. طبعا التفاصيل is not there yet, لكن it's mostly going to be يعني with the Ministry of Health. So currently, the Ministry of Health is assigned to the HTA body. Whatever is going to happen to Mamlaka when it comes to HTA is going to be as part of the HTA. They're not stopping. I think they're moving. ممكن بصمت, but definitely I would say within the year or so, we will start hearing something official. So I don't want to talk about anything that's not official. Like what I can say, as I mentioned, within a year or two, the official announcement will be made. This is for your first question. For the second question, I would say there's a lot of opportunity when it comes to health economics. One of the opportunities is estimating the economic burden of disease. يعني زي ما تفضلت قد يكون في bias موضوع economic evaluation, لكن as part of the social responsibility for company X, for example, they may do study related to what is the economic burden of asthma for Saudi. They're not promoting any drug, but they're just trying to capture economic burden of asthma. And this is important because it will help understand the magnitude of the burden. So that part of the role could be some of the things that a health economist in a pharmaceutical company. The other thing is, I know nowadays some of the pharmaceutical industry are investing in disease registry. So also some of the economic analysis when it comes to healthcare utilization. We want to know how often these patients you consume healthcare resources, regardless of medication or promoting any product. So those are some of the things that could be done in the future. I hope that answers your question. وهذه احد الاشياء اللي زي ما ذكرت.
السلام عليكم
NIH فيها تقصير. تفضل خالد.
اول شيء شكرا لك دكتور على المحاضره الثريه بالمعلومات، ودنا صراحه لو تعطينا نصيحه خلال خبرتك، وش الطريق الافضل ما بعد التخرج؟ هل هو الوظيفه في البدايه او اكمال الدراسه كفارماكو ايكونومكس؟
والله my opinion, it depends. What do you want? If you want stability, a job is the way to go. You get income. If you can do both, زي ما فيصل قاعد يسوي، ما شاء الله I applaud. If you can do both, I think this is amazing. And this would tell about some of your skill set. Believe it or not, employers sometimes see things that you didn't expect them to see as strength in your CV. And I'll tell you a story that you may relate to this. So when I was doing my master in the US, I did my master in New York. So at the time, in New York, it was, as you know, it's very expensive to live in New York, and the salary that we get from the Saudi Cultural Mission was really low. So كان 1200 تقريبا ريال. So I worked in the university. First I worked as a security على البوابة حقت سكن الطلاب, and then I worked as kind of administrator, يعني زي المراسل بين الكليات. So the good thing about the university is that they يعني offer job for students. معليش أنا قاعد أقلب عربي وإنجليزي، خلوني أحول عربي أحسن. فالشاهد إنه كنت أعمل في الجامعة لأنه كانت المكافأة 1200. فكنت عشان أقدر أسدد يعني الأجار كان يكفي، لكن مصاريف الأكل وغيرها، فكنت أشتغل في الجامعة. اشتغلت أول شيء سيكوريتي، أفتح البوابات حقت سكن الطلاب، وبعدين اشتغلت زي المراسل في الجامعة، ودي أوراق، صور أوراق، كانوا يدفعون لنا مبلغ كويس يعني. So الشاهد I worked these jobs not because I wanted to put them in my CV. للأمانة, you know, job to give you more money so you can live comfortably. بعد ما خلصت الماستر، آخر ترم في الماستر سويت internship. Where did I do the internship? I did the internship in New York Presbyterian Hospital. So New York Presbyterian Hospital, for those of you who don't know it, it's the best hospital in New York State. Okay? وترتيبه السادس على أمريكا. New York Presbyterian Hospital. So I did my internship there. وقلت لما برجع السعودية خلاص بحط بالسي في إني أنا سويت الانترنشيب في نيويورك بريسبيتيريان هوسبيتالز، والعالم يقولون تعال وينك احتريك احنا بنوظفك. رجعت السعودية 2008 ما لقيت وظيفة، قعدت 3 شهور ما توظفت. صراحة it was shocking إنه I didn't find a job، وأنا أول دفعة في الابتعاث. Keep in mind I'm the first. أول دفعة في الابتعاث مسوي الانترنشيب مسوي الانترنشيب في افضل مستشفى في ولايه نيويورك. It was shocking. الشاهد مو بهنا، الشاهد انه بعد 3 شهور جتني مقابله في الحرس luckily. ولما سويت المقابله الدكتور الله يذكره بالخير هو الفارماسيست شاف السي في حقتي اللي قابلني. الشيء الوحيد اللي لفت نظره not that I يعني have a good GPA, not that I did my internship in the best hospital in New York State, is the fact that I worked in the university. لفت نظره قال كيف اشتغلت في الجامعة؟ ليش تشتغل في الجامعة؟ قلت والله اشتغلت عشان. فالشاهد كان هالشيء البسيط هذا اللي I just put not thinking that will help me. بعد الله يعني بعد توفيق الله هو مفتاح للوظيفة that I'm actually still in right now about 15 years ago. فهذه عودة لسؤالك يا خالد.
ما شاء الله عليك يا دكتور. That shows tenacity, that shows determination. أنا لو واحد يجي بالسي في هذا أكيد بيكون هذا السؤال، لأن وريني الشخص ما شاء الله عليه زي كذا دكتور، الله يعطيك العافية، شخص عنده determination tenacity إنه يشتغل على نفسه. الله يعطيك العافية دكتور. نبغى ننهي هنا. بالنسبة لجين ولمع أسئلتكم بتوصل للدكتور إن شاء الله، وبوصلها لكم إن شاء الله عن طريق الواتساب أحمد، لكن نبغى نخلي الدكتور يرتاح الحين، بيض الله وجهه ما قصر، ويعطيك ألف عافية يا دكتور. الشكر لا يكفيك والله الذي لا إله إلا هو.
شكرا شاكر لكم، الله ينفع بكم، فخور فيكم، وجدا متطلع لنجاحاتكم جميعا. شكرا جميعا.
أذكر أسامي هذه متطلع معهم انهم بيقدموا شيء جميل لوطننا الغالي ان شاء الله.
باذن الله باذن الله. في امان الكريم.
الله يسعدك.
مع السلامه.
في امان الكريم.
شكرا دكتور سليمان على المحاضرة الأكثر من رائعة، واستفدنا الكثير من خبرتك العظيمة. وبكذا نكون وصلنا نهاية محاضرتنا اليوم. أشكركم جميعا على حضوركم وحسن استماعكم. كانت معكم أميرة المكاوني، والسلام عليكم ورحمة الله وبركاته.